Hello Damsonians, welcome to the solution of medicine CBT question set 2. I am Dr. Srinath Chandramani. Let's get started with the questions in order. Question number 1. Following clinical features suggest the spinal cord disease except for. Whenever there is a spinal cord disease, it is a central. So the lesion is going to be symmetrical. Because it's a small anatomy, it is going to be symmetrical involvement. Bladder involvement is common. Distinct sensory level is there. Back pain is likely to be present. And patient is likely to have a clonus. Severe spasticity is likely to be present. And all the modalities, that is sensory, autonomic, and motor will be affected. All the modalities, the sensation, the motor and autonomic are affected in the spinal cord lesion. All of this will be true except for weakness along the nerve distribution. As the name says, it itself is a feature of peripheral neuropathy. Question number 2. When a patient was brought to the emergency room with altered sensorium, a CT brain was performed. CT scan is the first choice, imaging of choice in the emergency because it is more easily available, it is much faster than the MRI and can be done without patient cooperation also. It can be done without patient cooperation also. That is why making it the first choice of neuroimaging in the emergency. The presence of the crescent sign. The presence of crescent sign on the CT scan is specific for the subdural hematoma. The presence of the crescent sign is specific for the presence of subdural hematoma on the CT scan. Subdural hematoma typically seen in elderly people, especially after trauma. Question 3. When a young woman presented with the secondary amenorrhea and galactorrhea, this is the most typical presentation of the prolactinoma. This is the typical presentation of a prolactinoma, that is a pituitary tumor, prolactinoma. And when the patient gives history of headache over the last few months and MRI confirm the presence of pituitary tumor. Once the pituitary tumor is confirmed, the next step in the treatment is to start the patient on bromocriptine. Bromocriptine is the dopamine agonist which is going to suppress the prolactin secretion and offer the reduction in size of the tumor. So whenever there is a prolactin secreting tumor, elevated prolactin level are there, the first line treatment is to go for bromocriptine. The multiple endocrine neoplasia 1 and 2 are differentiated by the presence of medullary carcinoma of thyroid. The multiple endocrine neoplasia 2 is mainly known because of the presence of medullary carcinoma of thyroid. The easy way to remember the MEN1 syndrome, it is called as the 3P syndrome, where there is a parathyroid, a pituitary and a pancreatic secretion. The MEN1 is called as the 3P syndrome, while medullary carcinoma of thyroid is selective for MEN2 syndrome. The presence of AST to ALT ratio is more than 2 in alcoholic liver disease because of the decreased synthesis of ALT, which is also known as SGPT. I used to remember L for liver specific is the SGPT. The secretion is synthesis is reduced in liver disease. That is why the ratio becomes more than 2, which is selective for alcoholic liver disease. Which of the following viral infection is associated with highest risk of progression to fulminant disease and acute liver failure? The presence of hepatitis B infection can lead to more risk of chronic liver disease, eventually cirrhosis. Chronic liver disease eventually leading to risk of the cirrhosis as well as cancer. But the presence of HDV co-infection, it is a partial virus. Hence, it can cause infection only together with hepatitis B. So, it can cause symptom only when it is together with the hepatitis B. But the chances of getting hepatitis D can be two ways. Either you can get a co-infection where HBV and HDV infection occur together. Then the risk of chronicity is increased. But not of fulminant disease. But it is the presence of the HDV super infection which is associated with risk of fulminant disease and liver failure. When a patient who is HBV positive then contracts subsequently, there is a subsequent HDV infection. This is called as a super infection associated with maximum risk of fulminant disease. The question number 7. When a 78-year-old confused man presents to the hospital of not passing stool for 3 days, he also reveals there is a risk of 8 kilo weight loss, history of 8 kilo weight loss. So we are suspecting carcinoma colon. And the tumor marker associated is the carcinoembryonic antigen. Is associated with risk of CA colon. Most common cause of hypothyroidism in the world is now autoimmune thyroiditis. Previously, it used to be iodine deficiency, especially in the developing countries. But the presence of iodinized salt has decreased the risk subsequently, and the most common cause now remains autoimmune thyroiditis. When a young male presents with gastric outlet obstruction and vomiting, persistent vomiting can lead to loss of HCl from the stomach, leading to hypochloremic alkalosis. Along with dehydration because of persistent vomiting. In this situation, the best fluid to be given is to give normal saline. The normal saline contains both sodium and the chloride replacement. Chloride replacement is good to replace the lost chloride from the stomach and making it the best single fluid in the patient with persistent vomiting. RL would have been the correct answer, preferred when the patient is having only dehydration due to diarrhea. There is only dehydration secondary to diarrhea. You may consider Ringer lactate solution. But in persistent vomiting, the loss of chloride also needs to be accounted for. Hence, normal saline is best treatment. Question number 10. Identify the following clinical manifestation. So this is the presence of a typical, this is a blood red color rash. It is a blood red color rash. That is why it is known as the erythematous rash, which is present over the maxillary area, without sparing the nasolabial fold. It is going to be present, which is the classical feature of SLE, malar rash, the most specific feature of SLE. The most dreaded manifestation of SLE used to be renal failure, was previously renal failure, but advances in the therapy has reduced the risk of RPGN, reducing risk of mortality due to renal failure. Presently, the most dreaded manifestation is heart failure. The most dreaded manifestation now is heart failure, which occurs because there is thrombosis and atherosclerosis. There is both thrombosis and atherosclerosis, which occurs due to the damage to the vascular endothelium. Damage, which is brought about by the elevated levels of pro-inflammatory cytokines present in the blood of SLE patient. The pro-inflammatory cytokine present in the blood of SLE patient leads to the development of thrombosis, atherosclerosis, increasing risk of heart failure. It is the most specific antibody for the diagnosis of rheumatoid arthritis is the anti-CCP, that is anticyclic citrullinated protein. The rheumatoid factor is the most sensitive, that is the screening antibody for RA. It is preferred for the screening antibody for case of rheumatoid arthritis. ANA remains the overall most sensitive antibody in autoimmune disease. In all the autoimmune disease, especially lupus, ANA remains most sensitive antibody, and ANCA is sensitive for vasculitis syndrome. The ANCA is sensitive for the vasculitis syndrome. We can say that. Sensitive for vasculitis syndrome. Question 13. Which of the most common infection precedes the reactive arthritis? The correct answer now is chlamydia associated urinary tract infection. Chlamydia associated urinary tract infection is the most common infection. Old name gonococci used to lead to the Retter's syndrome. This is the old name of the reactive arthritis when gonococci infection led to Retter's syndrome. But gonococcal infection has become uncommon due to availability of penicillin therapy. Due to antibiotic availability, gonococci infection has become less common today, and presently most common infection preceding reactive arthritis is chlamydia associated urinary tract infection. Question 14. When a female patient has difficulty in standing up from squatting position, cannot comb her hair, so she is complaining of a proximal muscle weakness. which indicates myopathy. But along with the myopathy, she has having violaceous heliotropic rash over the upper lid. That is, she is also having skin involvement along with muscle weakness, which is typical of dermatomyositis. Typical of dermatomyositis, we can say that. When a young male presents with complaints of passing blood in the urine and urine microscopy shows the presence of RBC cast, it is diagnostic of glomerulonephritis. It is diagnostic of glomerulonephritis, we can say. Question 16. A 20-year-old patient developed upper respiratory tract infection followed by elevated creatinine. So patient is having a post-pharyngitic glomerulonephritis. Patient is having a post-pharyngitic glomerulonephritis is present. But the age of the patient is young patient and the problem occurred 10 days after the event. 10 days after the event, and the complement levels are reduced with anti-DNase positive. This favors diagnosis of post-streptococcal GM. Diagnosis of post-streptococcal GM is the present in this answer. Question 17. A patient presents with both hemoptysis and hematuria. This is known as the pulmonary renal syndrome. When both lung and kidney are affected, we have got two differential. Either it is Goodpasture or vasculitis syndrome. But the presence of anti-GBM antibody confirms the diagnosis as Goodpasture syndrome. Anti-GBM antibody confirms diagnosis of Goodpasture syndrome. Question number 18. A young male presented with development of recurrent hematuria and deafness. Whenever you think of hematuria, deafness and lens defect, hematuria, deafness and lens defect, cataract, this is the triad of Alport's syndrome. This is the triad of Alport's syndrome, and Alport syndrome is a X-linked defect. X-linked defect most commonly in the alpha 5 subunit of type 4 collagen. Alpha 5 subunit of the type 4 collagen. That means there is a defect in the collagen, the type alpha 5, collagen type 4 alpha 5 gene defect is most likely associated with risk of Alport's syndrome. The most sensitive parameter to differentiate between intrinsic and pre-renal AKI is a direct statement is FeNA. The most sensitive parameter to differentiate between intrinsic and pre-renal is FeNA. Because the presence of FeNA less than 1% favors the diagnosis of pre-renal AKI, while the presence of FeNA more than 2% favors the diagnosis of renal, that is also known as intrinsic AKI. Also known as intrinsic AKI, making it a sensitive marker to differentiate between the two. Question number 20. Fanconi's triad, which is associated with the proximal renal tubular acidosis, also known as type 2 renal tubular acidosis, occurs due to the nutrient reabsorption defect. Occurs due to the nutrient reabsorption defect in the PCT, proximal convoluted tubule. PCT normally absorbs the glucose, the amino acid, and the phosphate is normally absorbed by the PCT. Now they are all lost in the urine. Glycosuria, amino acid urea and phosphate urea except for calciuria. The presence of excess calcium in the urine is a feature of type 1, also known as distal RTA. The hypercalciuria is a sign of type 1, also called distal RTA. In the question 21, the most common arrhythmia in a breathless patient presenting to emergency room is the sinus tachycardia, because in the breathlessness the patient is having two problems. One, hypoxemia and anxiety. The breathless patient is both hypoxemic and anxious, which leads to increased sympathetic tone, which is responsible for causing sinus tachycardia irrespective of the cause. Irrespective of the cause of breathlessness, the patient will most likely have sinus tachycardia. In question 22, the most common mechanism in hypoxemia. Why do patients develop reduced oxygen in the blood? The most common problem is ventilation perfusion mismatch. VQ mismatch occurs in diseases like COPD, in interstitial lung disease and pulmonary thromboembolism, where there is defect between the ventilation and perfusion matching, leading to defect in oxygen diffusion, leading to hypoxemia is most common mechanism. 23. The most likely infection preceding development of bronchiectasis in the world is now tuberculosis. Previously, in the Western countries, the most common cause used to be viral bronchopneumonia. Old answer was the viral bronchopneumonia used to predispose to development of bronchiectasis. But now the most common infection worldwide remains tuberculosis. The first line drug for the management of mild attack of acute asthma. What we used to give when acute asthma used to come? We used to give patient salbutamol nebulization. Salbutamol nebulization relieves the symptoms in majority. It relieves the symptoms in majority. Hence, it was commonly prescribed. But salbutamol, because it is short acting, it does not prevent relapse. There is no prevention of the relapse. No prevention of the relapse. And that is why, according to the new guideline, the best treatment is to give LABA, long-acting beta agonist plus inhaled corticosteroid, which not only relieves symptom but also prevents relapse. So we want to give a drug which will do both. That is why salbutamol is no longer the correct answer. Correct answer is to give long-acting beta agonist plus inhaled corticosteroid. Question 25. Atypical pneumonia can be caused by all the organism except for Klebsiella pseudomonas, the streptococci and the staphylococci. These are the 4 organisms which are considered causes of classical pneumonia. They are the classical organisms, means organisms causing infection in majority of the cases. Atypical pneumonia includes Mycoplasma, Legionella, the human coronavirus, and the pneumocystis infection. Pneumocystis pneumonia are all examples of atypical pneumonia. But how will you manage a patient with pneumonia? 26. When a 30-year-old male presents with the 2-day history of fever along with cough and expectoration, patient is having pneumonia. So we calculate CURP 67. C stands for confusion. Look for the CURP 65 criteria. C stands for confusion. Elevated urea level more than 7.1. Presence of respiratory rate more than 30. Presence of blood pressure less than 90/60. And presence of age more than 65. If you calculate the CURP 65 in this patient, patient is not more than 65. Patient is having the respiratory rate of 24, not more than 30. Urea is 6, not more than 7.1. And the patient is alert. The patient is alert. There is no problem with the confusion also. BP also is more than 90/60. So the CURP score in this patient is 0, indicating patient is a case of mild community acquired pneumonia. In a mild pneumonia, you can start patient on OPD patient treatment with macrolide therapy. OPD basis treatment with macrolide therapy would be best single answer. Question 27, direct answer. The treatment of patient with myocardial infarction is thrombolytic therapy when they present within the window period of 12 hours. So we are asking window period in MI is 12 hours. Know the window period. What is window period in the stroke, window period in MI, and window period in pulmonary embolism? Window period in stroke is 4.5 hours. In MI is 12 hours. In embolism is 14 days. In the embolism is 14 days. Correct answer is B, 12 hours. The most common cause of secondary hyperthyroidism, typically presenting as a young onset, typically comes with young onset, that is onset less than 30 years of age, hypertension, is renal artery stenosis, also known as the renovascular hypertension. This is known as the renovascular hypertension, we are going to called as the renovascular hypertension. Question 29. Which of the following drug is not a beta blocker? Not a beta blocker is sotalol. Sotalol is actually a type 3 anti-arrhythmic drug. It is a type 3 anti-arrhythmic agent. That is basically it is a potassium channel blocker with additional beta blocking action. With additional beta blocker action. So it is not a primary beta blocker, but it is a type 3 anti-arrhythmic drug, while all the others are cardioselective beta blockers. All the others are cardioselective beta blockers. Correct answer. Question number 30. The most preferred anti-arrhythmic drug in the emergency management of tachyarrhythmia is the amiodarone. Why? Amiodarone has the most potent drug. It is most potent drug because it is primarily class 3 action with additional class 1 property. So it has got double action, making it most potent. Side effect, it has got the least risk of torsades points. So side effect is minimum, least risk of torsades point, and it is the only drug to prevent the sudden cardiac death. It is the only drug to prevent the sudden cardiac death, making it the most preferred anti-arrhythmic agent in the emergency room. Please remember, adenosine remains the drug of choice for PSVT. Beta blocker is the preferred treatment for the AFib prophylaxis. And calcium channel blocker, that is non-dihydropyridine, diltiazem, verapamil, also belong to the class 4 anti-arrhythmic drug. They are the class 4 anti-arrhythmic drugs. But the single best for emergency is to go for amiodarone. I hope you got the questions right and you are prepared well for the upcoming exam. All the very best to all of you. Thank you.